Body scanners, QR codes and health passes. As news spread that 2 cases of Nipah virus had been found in India, authorities at the Pakistan border and in 6 countries' airports imposed measures reminiscent of the COVID pandemic. Far from being put off, some travellers were relieved by the added security.
Of course, we're all afraid of all the viruses, especially after Corona. Everything is going to change and we lost so much people. So we think we should be very careful about these kind of diseases.
Often spread by fruit bats with a fatality rate between 40 and 75%, authorities have learned to take outbreaks of Nipah virus extremely seriously. Most worrying for those exposed, there is no vaccine or treatment available.
So far, only 2 patients have tested positive. The remaining contacts, approximately 200 of them, have been quarantined, and those who showed symptoms have also been tested. Apart from these 2 patients, no one else has tested positive yet.
Experts say Nipah has inconsistent symptoms that may mask the true number of cases, with small-scale outbreaks not uncommon in the region and usually stopped by the difficulty of human-to-human transmission.
There is fever, headache, pain in the whole body. Along with it, there is pain in the throat and a cough. The cough transforms into pneumonia-like conditions. There is difficulty in breathing. Then gradually, the infection spreads to the brain, which reduces the senses of the patient. Eventually, the patient goes into a coma.
A quick boost to border security aims to strengthen that transmission barrier. But with symptoms of Nipah taking weeks to appear, experts have questioned their efficacy.
What this means is that it's actually very difficult to control airports if you've got a disease that's got 2 weeks incubation period. For the first 2 weeks after somebody's carrying the infection, there's no way you can pick it up.
So far, none of the isolated contacts have reported symptoms. Angus McIntosh, ABC News.
Dr. Khaja Abbas is an associate professor at the London School of Hygiene and Tropical Medicine and Nagasaki University and joins me now. Good to have you with us on the program. Firstly, can you explain to us what is Nipah virus, what are its origins and how does it spread?
Yeah, the Nipah virus was discovered in 1999. It's a zoonotic virus and the natural reservoir for this virus are the fruit bats. And the earlier outbreaks that took place in 1999 were in Singapore and Malaysia. And primarily the spread was from bats to pigs. And then from when the pigs were butchered, and that's where the humans got infected. But then since 2001, the outbreaks have been taking place primarily in Bangladesh and India. It's kind of recurrent, but sporadic, and only a few cases. Like up to date, we have only around 750 cases altogether. But of the 750 cases, as you mentioned, very high case fatality rate, more than 400 of them actually died from it. But the risk of transmission is very low, and thereby the cause for concern is relatively limited compared to, say, the COVID pandemic that we had, because one of the major issues with SARS-CoV-2 was there was a lot of asymptomatic transmission, like people who didn't show symptoms could transmit the disease. While in the case of Nipah, it's very rare. Like somebody who doesn't show symptoms is unlikely to transmit the infection. So once you are able to take care of symptomatic patients, and then you stop potential transmission from those patients to other, to their contacts, then primarily the outbreak pretty much ends out there. Yeah.
Yes, and then what symptoms do people who contract Nipah virus suffer from?
It starts off like similar to flu, like headache, fever, but then it can actually progress towards encephalitis, which is basically the inflammation of the brain. And that's where it becomes quite severe and high case fatality rates happen at that time. But that being said, it's when they do show the symptoms, and that's when they are likely to transmit either through droplets or also through like bodily fluids, and thereby it's much more easier to contain, because once you stop that transmission pathway, practically you stop the outbreak there. Yeah.
Yes, and is there a need for sort of, the public, particularly in West Bengal, where there were these 2 cases, to be alert, but of course not alarmed?
it's very likely to be very controlled, like even within locally, even within the area, like within West Bengal, it's in Basra, very close to Calcutta, that there should not be that much of a concern. And what you have seen so far, historically, there have been few cases in each of the outbreak, but they have to be well supported. Like currently people are having the Nipah infection, they need to be supported intensively until they recover well. But also making sure we follow the basic public health measures of hygiene and also like case isolation, and then making sure all those protocols are in place, and then that will automatically make sure we cut off the transmission.
Yes. So the two things we know about, in terms of how to deal with it is that there are no vaccines for Nipah virus, but also that the fatality rate is quite high. What are the existing treatments at the moment to treat someone who has contracted Nipah?
And again, we don't have any licensed vaccines, nor do we have any approved treatments either. So the only way what we can do to make sure that people can recover is provide intensive supportive care. But that's really, I'm hoping that their immune system will be able to pick up and able to fight the disease. But we don't have any cure approved so far, nor a vaccine.
Yes, and we're seeing pictures earlier of airports in Hong Kong, Singapore, Malaysia doing screenings of passengers. Are authorities and people more cautious about reports of viruses out there, even a small outbreak like Nipah in this instance, because we've had that pandemic a few years ago?
I mean, and even before the COVID pandemic, since the SARS outbreak that we had in 2003, the SARS-CoV-1, the first virus, and that virus also only spread when patients were symptomatic, and that's why we were able to contain it quite well in 2003. But before we were able to understand the transmission pathway, it spread to multiple countries. And then since the impact was especially quite high in East Asia, since then, the airport screening has been like almost like readily deployed almost all the time, even in normal peace times, as we call it. And then, of course, the screening becomes even more heightened when there are outbreaks occurring in nearby countries. Yeah.
Okay, Dr. Khaja Abbas, really good to hear your expertise on this. Thank you so much for your time.
Sounds good. Thank you for having me.